What is pneumonia? Pneumonia is a serious infection that affects the lungs, causing inflammation in the air sacs, or alveoli, which can fill with fluid or pus, making it difficult for oxygen to pass through the air sacs into the bloodstream. The infection can be caused by bacterial pneumonia, often caused by Streptococcus pneumoniae, Haemophilus influenza, and Staphylococcus aureus. This form can be particularly severe in older adults or those with weakened immune systems. Viral pneumonia, caused by viruses like influenza, respiratory syncytial virus, RSV, or coronaviruses, also known as COVID-19. While viral pneumonia is often less severe, it can still cause serious complications, especially in vulnerable populations. Fungal pneumonia, less common but can occur in immunocompromised individuals, caused by fungi like histoplasma or coccidioids. So, why do people die from pneumonia? Pneumonia can be deadly for several reasons. Weakened immune systems. People with weakened immune systems, such as the elderly, young children, and individuals with chronic diseases like HIV, diabetes, or cancer, are more vulnerable to severe infections. Delayed treatment. In some cases, pneumonia is not diagnosed early or treated promptly, leading to complications. Bacterial pneumonia, for instance, may require antibiotics, and viral pneumonia may need antiviral medications or supportive care. Respiratory failure. Pneumonia can lead to fluid accumulation in the lungs, making it harder to breathe. If untreated, this can result in respiratory failure, where the lungs can no longer supply enough oxygen to the body. Sepsis. In severe cases, pneumonia can lead to sepsis, a life-threatening response to infection that affects the entire body. It can cause organ failure, shock, and death if not treated quickly. Complications. People with underlying lung conditions like asthma or COPD, heart disease, or other chronic illnesses may be at higher risk for complications, making pneumonia more likely to be fatal. Control measures to prevent pneumonia. While pneumonia can be a serious condition, there are several steps that individuals and communities can take to reduce the risk and prevent its spread. Vaccination. Pneumococcal vaccination. This vaccine protects against certain strains of bacteria that cause pneumonia. It is particularly important for infants, the elderly, and individuals with weakened immune systems. Influenza vaccine. Since the flu virus can lead to viral pneumonia, getting the annual flu vaccine can reduce the risk of developing pneumonia from influenza. COVID-19 vaccination. COVID-19 can cause severe viral pneumonia, so vaccination helps reduce the risk of both contracting and spreading the virus. Good hygiene practices. Regular hand washing with soap and water, especially during flu season, can prevent the spread of respiratory infections. Covering the mouth and nose when coughing or sneezing, preferably with a tissue or elbow, helps prevent the spread of infectious droplets. Avoid smoking. Smoking damages the respiratory system, making it more susceptible to infections like pneumonia. Quitting smoking is one of the most effective ways to reduce the risk. Avoid alcohol. Although it does not directly cause pneumonia, alcohol increases the risk of aspiration pneumonia, which occurs when food, liquid, or vomit is inhaled into the lungs, leading to infection. People who drink heavily are more likely to experience episodes of vomiting, and the aspiration of stomach contents into the lungs can cause a bacterial infection. Strengthening the immune system. Healthy diet and hydration. A balanced diet rich in vitamins and minerals supports the immune system, making the body more resilient to infections. Regular exercise. Regular physical activity helps maintain a healthy immune system and improves lung function. Prompt treatment. Early recognition and treatment of pneumonia are critical. If symptoms like cough, fever, and difficulty breathing appear, seeking medical attention right away can help prevent severe complications. Improving air quality. Reducing exposure to air pollutants and respiratory irritants, such as dust, fumes, and secondhand smoke, can decrease the risk of pneumonia. Proper medical management. For people with chronic diseases or compromised immune systems, regular medical checkups and timely interventions can help manage risk factors that might contribute to pneumonia. To conclude, pneumonia remains a major global health concern, particularly for vulnerable populations. While it can be a serious and life-threatening condition, understanding its causes, recognizing the risk factors for fatal outcomes, And implementing prevention strategies such as vaccination, good hygiene, and a healthy lifestyle can help reduce its impact. Early diagnosis and prompt treatment are crucial in managing the disease and preventing complications. By taking proactive steps, we can significantly reduce the incidence and mortality of pneumonia worldwide.